Nowhere is this more evident than decisions regarding end-of-life care. As I noted earlier, the debate in Washington right now is not really the debate that we need. I'd like to see the adoption of policies that use statistical models and evidence-based medicine. Let's use science to drive what we're paying for so we can get the most for our healthcare dollar. Actions of healthcare providers and health systems are now understood to determine only about 30% of your health. Other factors like housing, education, employment, the physical environment, as well as social status and support networks account for 70% of your health. Many of these social determinants of health are outside the influence of the healthcare sector. Community pressure needs to be brought to bear to address these issues. The conventional wisdom is that the U.S. gets less for its health dollar and has worse outcomes than much of the industrialized world. However, if you normalize life expectancy to eliminate the influence of violence and fatal injuries, the U.S. actually comes in first, ahead of Switzerland and Norway. If you normalize for poverty, you find similar outcomes. This means that communities themselves must address more fundamental social issues like housing, education, poverty, and violence. Decisions you make in your community to invest in the social determinants of health will actually have a greater impact on the health of your community and the cost of health care than your decisions about the healthcare sector itself. In conclusion, again, I want to reiterate what I said at the beginning. When you leave here today, I want all of you to understand 4 key points. Spending on health care will continue to increase. This is not a value judgment, it's simply the economic reality. Growth is inevitable. Your communities will be economically disadvantaged if they don't act to capture their fair share of the growth. Because health care will have an increasing share of GDP, public policy makers and the healthcare community have greater obligation than ever to work together to deliver value for the healthcare dollar. Creating the value we want from the system will only happen if we collaborate, understand the drivers of growth and of community health, and use evidence-based approaches to drive healthcare decisions. And that leads me to a new point, which is actually the most important of all. And in fact, if you can't remember the first 4, just remember this one. Communities must invest in the social determinants of health. This is the most effective way to move the healthcare needle. I know it's easy to look at healthcare today and feel hopeless about your ability to influence the economics. However, I would contend that those of you in this room are a force as powerful as those of us in the healthcare sector, and perhaps more so. Together, we can work to improve affordability, value, and outcomes for individual consumers and patients, and recognize healthcare as a source of good-paying, family-wage jobs that can be an economic engine in your community. It won't be easy, but it can be done together. Thank you.